UVA study, weight loss drugs and fitness truth exposed. Ready for a reality check that might surprise you? While the latest wave of weight loss medications like Ozempic and Wegovy are making headlines for their dramatic ability to help people lose weight, a group of researchers at UVA Health says there's a crucial part of the story that isn't being told, and it could affect your long-term health more than you think. Yes, these GLP-1 based drugs can help patients drop significant numbers on the scale, sometimes transforming their outward appearance. But here's where it gets controversial. Shedding pounds with these medications doesn't mean your actual fitness or health is improving in meaningful ways. In fact, that slimmer body might still be at risk because cardiorespiratory fitness, a key indicator of how long and well you'll live, shows little to no improvement, even as the pounds melt away. Are we trading one health goal for another, but missing the point? That's the finding from a recent UVA study, where researchers dove deep into what happens behind the scenes when people use GLP-1 drugs for weight loss. The summary? People might look healthier, but internally, especially when it comes to how their heart and lungs work during activity, they're not necessarily fitter. Cardiorespiratory fitness, often measured by VO2 max, think how effectively your body uses oxygen during exercise, is a far better predictor of health outcomes than weight alone. Simply put, running, swimming, or even brisk walking put your system to the test far more than numbers on a Bactrim scale ever will. And this is the part most people miss. The drugs don't just melt away fat. They also reduce something known as fat-free mass. Here's the catch. Up to half of that lost is muscle tissue. Dr. Zhenqi Liu, who previously led UVA Health's Division of Endocrinology and Metabolism, warns, some patients have actually told me they could feel their muscles wasting away on these medications. That's a big deal. Our larger muscle groups, especially those supporting our core and posture, are essential not just for looking strong, but for basic movement and quality of life. Imagine reaching your target weight, but feeling weaker and less able to do everyday tasks. Is that a fair trade-off? So, what should people using these medications do? The study, authored by Dr. Liu, kinesiology expert Dr. Siddhartha S. Engadi, and graduate researcher Nathan R. Wheeldryer, emphatically urges that weight loss from medications be paired with regular physical activity and sufficient protein intake. This combination is essential to preserve muscle mass and enhance actual cardiovascular wellness, not just appearance. For example, integrating resistance training, like lifting weights or bodyweight exercises, can help offset muscle loss caused by the drugs, while consuming enough dietary protein can support muscle repair and maintenance. Here's a question to stir up some discussion. Should medical professionals, then the public, focus less on the number seen on the scale and more on holistic health and longevity? Or is rapid weight loss enough of a benefit, even if it comes at the cost of reduced fitness or muscle mass? What do you think? Is it time we rethink what healthy weight loss really means? Or could the promise of easy pounds lost be too tempting for most people to resist? Jump into the conversation below. We want to hear if you agree or disagree with these findings and your thoughts on the potential risks and rewards of this popular new drug trend. Ozempic hair loss and muscle wasting. What you need to know. Side effects explained. Imagine taking a pill that promises to transform your physique overnight, only to find yourself looking gaunt and dealing with unexpected side effects like hair loss and muscle weakness. This is the reality many users of Ozempic and similar GLP-1 drugs are facing. But here's where it gets controversial. While these medications effectively reduce fat mass, they're also linked to unintended consequences that go beyond just the notorious Ozempic phase. And this is the part most people miss: the impact on hair and muscle health. Ozempic, along with drugs like Mounjaro, Wegovy, Rybelsus, and Zepbound, has become a household name for those seeking quick weight loss solutions. However, the journey isn't always smooth sailing. One of the lesser-known side effects is hair loss, often attributed to rapid weight loss and nutritional deficiencies, rather than a direct result of the medication itself. Dr. Marissa Garshik, a board-certified dermatologist, explains that this hair loss, known as telogen effluvium, is a common response to significant stressors on the body, similar to what many experienced during the initial months of the COVID-19 pandemic. It typically manifests a few months after starting the medication, and while it can be alarming, it's often temporary and resolves once weight stabilization occurs. Muscle loss is another area of concern for individuals using these weight loss drugs. Contrary to popular belief, its muscle atrophy isn't exclusive to GLP-1 medications. It's a natural outcome of any weight loss regimen, whether it involves dieting, exercising, or surgical interventions. According to Dr. Holly Lofton, director of the Medical Weight Management Program at NYU Langone Health, medications like Wegovy and Zepbound lead to muscle loss comparable to traditional weight loss methods, sometimes even more so. Studies indicate that up to 30% of weight loss from calorie restriction and exercise comes from lean body mass, including muscle. Therefore, if someone loses 20 pounds, approximately 5 to 6 pounds might be muscle tissue. When using drugs like Wegovy and Zepbound, patients can expect to lose about 15 to 22% of their total weight, with nearly a quarter of that being lean muscle mass. This highlights the importance of balancing muscle preservation strategies, such as regular resistance training and adequate protein intake, alongside these medications. So, what can you do if you're experiencing hair and muscle loss while on these medications? First, it's important to understand that shedding 50 to 100 hairs daily is normal. However, if you notice significantly more hair falling out, or if the hair loss persists beyond 3 to 6 months, consulting a board-certified dermatologist is advisable. Blood tests can help identify potential hormonal changes or nutritional deficiencies that may contribute to hair loss, and addressing these issues through diet and supplements can promote healthier hair growth. Thickening and volumizing shampoos, as well as leave-in products, can also provide immediate relief and support hair density. For more intensive treatment options, PRP therapy is a viable solution to stimulate hair regrowth. Regarding muscle loss, the focus should be on maintaining adequate protein intake and engaging in muscle-building exercises. Dr. Lofton recommends a daily protein intake of at least 60 grams from high-quality sources such as egg whites, whey, animal meat, or beans. Additionally, incorporating at least 75 minutes of exercise weekly, and ideally closer to 240 minutes, can help preserve muscle mass. Balancing these factors is crucial for achieving optimal results from weight loss medications. In conclusion, while GLP-1 medications like Ozempic offer effective fat reduction, they also come with potential side effects that require careful management. By understanding these impacts and taking proactive steps to address hair and muscle concerns, individuals can enjoy the benefits of these medications while minimizing unwanted outcomes. Have a beauty or wellness trend you're curious about? Share your thoughts with Vogue's senior beauty and wellness editor at beauty@vogue.com. The truth about GLP-1 drugs. Weight loss and muscle loss explained. Imagine shedding pounds effortlessly, only to discover that your heart and lungs aren't reaping the full benefits. This is the surprising reality for many users of GLP-1 drugs, according to new research from the University of Virginia. These popular medications help people achieve significant weight loss, but they fall short in delivering a crucial improvement in cardiorespiratory fitness, a key factor for long-term health. GLP-1 drugs have become a go-to solution for individuals struggling with obesity, type 2 diabetes, and heart failure. The weight loss they facilitate brings numerous health benefits, such as better blood sugar control, short-term cardiorenal improvements, and enhanced survival outcomes. However, the story doesn't end there. Doctors might need to consider additional strategies, like exercise programs, nutritional supplements, or complementary medications to ensure patients experience the full cardiorespiratory benefits of their weight loss journey. But here's where it gets controversial. Some patients report feeling like they're losing muscle mass while on these medications. This isn't just a cosmetic concern. Muscle, especially axial muscle, is vital for posture, physical function, and overall well-being. Losing lean body mass can increase the risk of cardiovascular disease, all-cause mortality, and a diminished quality of life. We need to make sure that patients prescribed these medications aren't already at risk from malnutrition or low muscle mass, emphasizes researcher Zhenqi Liu, MD, professor of medicine at the University of Virginia School of Medicine. Let's dive deeper into the science behind this. GLP-1 drugs help people lose fat, but this often comes with a loss of fat-free mass, which includes muscle. In fact, fat-free mass accounts for 25 to 40% of the total weight lost, a significant proportion compared to the natural age-related decline of 8% per decade. This raises serious questions about the long-term consequences of such muscle loss. To understand this better, Liu and his team reviewed data on the drug's effects on cardiorespiratory fitness, CRF, also known as VO2 max. CRF measures how well the body uses oxygen during exercise and is a critical indicator of heart, lung, muscle, and blood vessel function. It's also a powerful predictor of all-cause and cardiovascular mortality risk. Patients with obesity often have low CRF, either due to insufficient muscle mass or poor muscle quality compromised by fat infiltration. Cardiorespiratory fitness is a potent predictor of mortality risk across various populations, including those with obesity, diabetes, and heart failure, explains Siddhartha S. Angadi, PhD, the Associate Professor of Kinesiology at UVA. In a recent global study, his team found that CRF was far superior to body weight in predicting mortality risk. This underscores the importance of understanding how GLP-1 drugs affect CRF. The researchers discovered that while GLP-1 drugs improve certain heart functions, they don't significantly enhance VO2 max. Some small studies suggest exercise might help, but larger, well-designed studies are needed to confirm this. The team concludes that GLP-1 drugs reduce body weight and fat, but there's no clear evidence they improve CRF. This could impact patients' metabolic health, health span, frailty, and longevity. And this is the part most people miss, though researchers are hopeful about future solutions. There are promising developments, such as a monoclonal antibody in the pipeline that could offset lean muscle loss. However, for now, it's crucial for patients on GLP-1 drugs to discuss muscle mass preservation strategies with their healthcare providers. The American Diabetes Association recommends screening for malnutrition and low muscle mass risk before starting these medications and promoting adequate protein intake and regular exercise throughout treatment. The findings, published in the Journal of Clinical Endocrinology and Metabolism, highlight the need for further research to ensure the best possible outcomes for patients. The UVA researchers, who have no financial interest in the work, emphasize the importance of staying informed about the latest developments. So, what do you think? Should doctors be more proactive in recommending exercise and nutritional supplements alongside GLP-1 drugs? Or is the focus on weight loss alone enough? Share your thoughts, and let's spark a conversation.